And welcome back. We are about to venture off into our first segment for the morning. And this morning, the Ministry of Health Breastfeeding Week and the Breastfeeding Forum. It's going to be from August 1st through to the 7th. And we've got the professionals in to tell us all about it. I can't wait to get into it. Now, in with us, we've got Dr. Jorge Polanco, who is, of course, a focal point for non-communication disease at PAHO Belize. And that guy is non-communicable. I'm sorry. I'm sorry. That guy is right here. And who else with us? We've got Nutritionist or the Ministry of Health, Robyn Daly. And she's looking so wonderful. Guys, good morning. It's so nice to have you in and welcome.
Thank you.
Breastfeeding, it's definitely the first thing that especially expecting mothers are being taught, how to nurture the child. Now, let's get into it. Breastfeeding Week, Breastfeeding Forum, talk to us.
Okay, so Breastfeeding Week is celebrated August 1st to the 7th. The theme for this year is Breastfeeding, Foundation of Life. And this is a week that we normally push a lot of our initiatives in terms of starting with nutrition and emphasizing the importance for mothers to breastfeed, and not only to start, but to emphasize exclusive breastfeeding for 6 months. That's what we're aiming for.
Wow.
Should be the case.
There's been an ongoing campaign in pushing exclusive breastfeeding. I think when the definition of exclusive is explained, people will understand why there's a need for us to talk about it. But let's start with what it means to exclusively breastfeed and where we are as a country.
To exclusive breastfeed means that you provide breast milk to the infant, only breast milk. No water, no other juices, nothing, no other fluids, no other food, just breast milk for 6 months, at least for 6 months. So as a country, we are actually having some improvements.
Nice.
So the latest mix, the multiple indicator cluster survey has showed that we are at 33%. We were about 20% about 5 years ago. So we've increased. So a lot of efforts have been pushed with the maternal and child health unit from the Ministry of Health, and looking at all of the protocols that are needed to have our baby-friendly hospital initiative underway. That helps a lot. All of our hospitals are certified as baby-friendly, so that helps a lot. And of course, this certification is underway. The recertification, I should say, is underway. But that helps to push the exclusive breastfeeding campaign that we're doing.
Nice.
Mothers are still, some mothers, especially the younger ones, and I keep on, especially when we've got shows that talks about mother and child, or a parent and child, still reluctant in terms of the breastfeeding, the whole breastfeeding aspect. I'm not sure if it's because they're watching the body or just for the look, but in terms of that mother-child bond, and then again we know that colostrum, that's the first milk. Talk to us about the importance of this, because they need to get on stream as well.
Well, our statistics has also shown that we have, we're doing good with the early initiation. A child should be having that that skin-to-skin contact within half hour of birth. And that is, we are about 68% with that, so that's pretty good. The exclusive sometimes is a challenge for mothers to do because time constraints. Which is one of our campaigns that we're going to be doing as well, trying to encourage workplace support for breastfeeding. That's very important, and that's something that we think would help to promote the exclusive breastfeeding, because most of the time mothers would stop when they need to go back to work. They might have difficulty pumping and that kind of thing, so they would just stop maybe after 3-4 months and not do the exclusive.
Now, from a regional and international standpoint, as a representative of PAHO, where does Belize fit in how we're doing in the promotion of breastfeeding and the results that we've acquired?
Compared to the other Central American countries, we are doing good. As Robyn mentioned, the last mix reported a exclusive breastfeeding rate of actually 14.7. Sorry, the second to last one, and this one of 2015, it was 33.2. So it's really more than double. So that does reflect a very good work at the level of primary health care, and of course within the institutional, within the hospital level. In regards to the promotion of breastfeeding. And the truth is that breastfeeding now, at the World Health Assembly, the ministers made a statement where they said breastfeeding should not be considered only as an individual choice, but it is a public health issue. And what they meant by that is that in reality, the reason why breastfeeding is promoted so much is because of the benefits it has to the newborn and to the mothers. You made a statement earlier as to this challenge of women taking that commitment to breastfeed for 6 months. And indeed, it is a challenge. Yeah. Indeed, you would see persons that you believe that appear to be within the possibilities of having an exclusive breastfeeding really do not do it. And as Robyn said, there are multiple reasons. But one of the challenges is that there is a need to really share information, the details as to the benefits of breastfeeding for newborns, the details in regards to the benefits to the mother. Believe me, they are huge. And I am very, very sure that every mother, if they would see the list of benefits for the newborn, the list of benefits for themselves in regards to the prevention of breast cancer, in regards to the prevention of cancer of the ovaries, in regards to the drastic reduction of hospitalization of infants during the first 2 years of life. When they would see all those details, I'm very, very sure that they would wish that for themselves. But I believe to some degree there is still areas where that information really does not reach, especially the first time parents. So that's the angle that we look at it here in Belize, that it's a public health issue, and our duty is to really promote it at every opportunity. Robyn made reference to the certification of the health facilities, and that's an ongoing activity throughout the year. The Ministry of Health is training staff so as to keep them, so as to prepare them for recertification. The recertification of the government facilities happens every 2 years. They are evaluated. It's a formal evaluation that goes in. An external team goes in and does that evaluation. And if they don't get 100%, they are not certified. They are given 1 month. So it's not like you get 90%. You have to get 100% of all the variables.
And the details in that really help. So everybody is trained. There are no bottles. Tell us some of the things why having a baby-friendly hospital helps in encouraging mothers to see this as the best route, exclusive breastfeeding.
Yeah, this initiative actually refers that the entire staff of the hospital, and entire I mean everybody, is trained. There is a curriculum that is used for professionals and for technical staff that is imparted, and it's mandatory for the staff to take it. Efforts are done, significant efforts are done to ensure that all the staff is trained. And there they will get information as to the benefits, the biological benefits, the individual benefits, the impact it has on the infant from the moment he or she is born right through to his first or second year of life. And the reason is why everybody is trained is because it is so important that they themselves become would form part of a team, the team that would monitor that the hospital would not allow for artificial milk to enter those premises. So this leads us into what we are having this coming week. It's a workshop whereby we will be presenting, sharing with medical staff the International Code of Marketing of Breast Milk Substitutes, which literally means that we need to be on the alert to ensure that formulas are not easily accessible, but on the contrary, to promote exclusive breastfeeding.
Is it regulated in Belize? I know in some countries you cannot advertise formula or substitute milk for children under 2.
We're working towards it. It is regulated, but it's not 100% enforced. Our facilities, our health facilities where we have control over, those are not advertised there, but sometimes if you go to a grocery store, maybe a supplier might be having some promotion, that kind of thing, or labels. So that's, like Doctor mentioned, that's something that we want to educate suppliers on and importers of baby formula, baby food on what are their restrictions and what we want to push, because now we need to really push to have this implemented in Belize. We want to have our exclusive breastfeeding up to at least maybe 50% by the next survey, because it's really important for them to understand.
You know, I have to say kudos. I mean, you've doubled the numbers essentially from almost 15 to 33, but 33 is still a low number. I have a question in how the Ministry of Health, or PAHO, works with private institutions. You know, I've had the first-hand experience of being being at both a public and private hospital, a baby-friendly hospital and a private hospital at the birth of a child. And I can recall being an advocate in the private institution, refusing for, which was my niece at the time, that she get formula because her mother was in the recovery room. And I realized, you know, comparing it to the public institution where it was just natural. Skin to skin was natural. The mother was recovering and they were attempting breastfeeding. It was just such a seamless transition. So my question is, if people are seeking out private care, what are we doing to get them on board if they're still stuck in these antiquated habits?
It's a work in progress. It is a challenge in terms of, because most of our, like I said, Ministry of Health facilities, they're all certified baby friendly, and we work along with the staff and to get the guidelines established and practiced. But in the private, it is a challenge. There is no private institution in Belize that's certified, private hospital certified as baby friendly. So they have been invited to our trainings and different things, and they have participated in our workshops and stuff like that. But to actually meet the certification process, it requires extra support, extra resources that they would need to be committed to. And I think, Doc, you had some experience trying to liaise with a couple private, but it is a challenge, and it's something that we need to continue working towards, because as we know, it's in the interest of the child, and it shouldn't be a decision where a private clinic would decide if they want to be baby friendly. Everybody should be on board. It should be something that we all promote together. So it's something that we have to continue working on.
You know, I like that.
What's the challenge in getting the buy-in, though?
Well, they have been approached. Information has been shared. They have been invited to participate in the training. We have not really gotten a response that we would have liked up to now, but I believe the area where we are free to work is whereby we should continue promoting exclusive breastfeeding to the mothers, to all those young ladies who are thinking of getting pregnant or who are in their prenatal stage. Preach it to them, promote it to them, let it be clear as crystal as to the benefits. If they would go to a private setting, then they would be the ones to say, I will breastfeed. Okay. That's not impossible.
When my child is born, let her do skin to skin or all the other things.
It's not impossible, but that's where the efforts need to go in sensitizing that cohort of pregnant women.
You know, one of the things that that we continue to notice would be that some mothers would do the one and done, and we're talking here the whole breastfeeding aspect. Put the child on, the child doesn't latch, and say, you know what, my child no want breast, none at all. And I'm so glad that we've got this forum now, because this, I think, is the time for us to, for you guys, a professional, to share with them some of the skills around trying to have that child latch on. This is a very important aspect of rearing a child.
Yes, and I must say there are techniques, very, very specific, pretty techniques, exciting, if I could use that word.
I like the word pretty too.
On how to let that infant latch on. The nurse is not here, but indeed there's a little technique whereby you would put the nipple above his upper lip, right below his nose. That in itself would cause a reflex, and then you would have him in a position, once he opens his mouth, you just slide in the nipple. There are several little techniques for that. Many times a very common reason is that they would stop it because of sore nipples, so there are also techniques to address that. Throughout the week, there will be talks by experts on this topic.
If I could add too, there is lactation counselors at every facility that can assist. The ministry has actually committees, baby-friendly committees at the different hospitals. So if there are challenges, they have counselors that work along with the mothers. So there really isn't a good excuse then if you're having problems with the latching. So they actually help and promote that the breastfeeding is done, and they work along with the mother, especially first-time mothers might have these challenges, but there is help. So,
Yeah.
What about
and
the...
it's overcoming the traditions too, because I think, like John said, it's the oh, they don't want it. There's the the baby's still hungry, or I'm not producing enough as
milk.
well, or it hurts. And these are things that the lactation counselor helps with, right?
Yes, that is true. And then it goes along also with that information that I said that should be given during the pregnancy period, during the prenatal period. Because the size of the stomach of a newborn is like a marble, the first few days. Very, very small. So with a few drops of milk, that would be sufficient.
Yeah.
And there are a lot of things that the parents would need to learn that that actually are cues that the baby is hungry. And if you do not know them, you won't recognize him. If you don't recognize him, you will not feed him on demand. There is this habit or custom or this behavior of saying, okay, every 3 hours I will feed you. But this is a newborn, and you should feed him when he is hungry. And he gives cues, he or she gives cues. So the parents should be able to recognize them and feed that infant. And the infant really would not be as fussy as he would be if he is hungry. And these little tips, these little sessions are what we promote at the level of health facilities, at the level of primary care sessions in mobiles and health centers, health posts. Because I personally believe that there is no mother that could say, I will not breastfeed my son because I do not love him.
Yeah.
If that decision is taken, I believe it's not because you don't love them, not because you don't want the best health for them, but simply because of a limited degree of information as to the benefits. So that's my vision. Give them all the information they need, and then they will make that.
What about...
Just because there is also this perspective, well, it's a woman's choice. That's true. It's a woman's choice, but it should be an informed decision.
Of course.
So if that choice is taken with limited information, then it will be, I can't breastfeed, I don't want it. But if there is sufficient information, it will be a smaller number of persons who would say, I cannot breastfeed or I don't want to. And something very important, Robyn made reference to it, is the facilitating, and I will repeat it again, it's so important, of the breastfeeding in the workplaces. A very common reason why people say, I can't breastfeed for 6 months is I may have to go back to work.
Yes.
That is true. They have to go back to work. Then let there be opportunities, or let there be an enabling environment in the workplace for that child to continue receiving breast milk.
Of course.
Either he is brought to the workplace, or the mother is facilitated to reach home, or she has a space where she could extract her milk. This is also, many places are doing it already. And then at the end of the day, she takes, I know of a case where the husband used to make sure that 12 o'clock he's at the workplace to collect the milk and take it home.
That's amazing. Can I ask, I really want to know, and I think they deserve the recognition. Tell us about some places that have worked with mothers to ensure that they exclusively breastfeed. I know life is real, and I'm sure mothers are watching and they're saying, oh, I only get, is it 14 weeks for maternity leave? Yeah, when that's done, I have to go back to work. Yeah. How is my baby going to eat if it's supposed to only be breast milk? What places do you know of that really help to accommodate, whether it's pumping stations, bringing the baby to feed, or whatever? I don't know how else to help.
Additional lunch break or additional time too.
Yeah.
That's a tough one.
Yeah.
Well, our Ministry of Health facilities for sure, and most of our government institutions within the public service supports that. So, and that's a lot.
Yeah.
Within the private sector, there is one, I don't want to mention it because I'm not too sure. But there was a forum last year where we had, or 2 years ago, where we had 2 employees and they went up and they shared their experience, but I'm not too sure which one of them. I can't remember the names. But there are some big...
there are a couple, I think maybe B&E.
Or BL. I'm not
BEL,
sure.
BEL, BTL. There are certain big organizations that have wellness initiatives underway, and they would be very receptive to encouraging the workplace breastfeeding and support for mothers. So there is a list. Honestly, we had a list of invitees that we had at that session, and we had groups discussions with them.
And they were from the private sector.
Yes, and they were all from the private sector, even with the Ministry of Labor. And we looked at what can we work along with them with to promote the workplace breastfeeding. But to remember I remember a couple of the big companies.
Well, we got some out.
Yeah, we got some out.
But I think it's just great to recognize it because it shows that it doesn't have to be mandated. You can implement it in your company if you're looking for the looking after the well-being of your employee and their children. But there are long-term benefits as well, right? Tell us what it means for the workplace. If we're talking to an employer who says, you want me to give an extra hour to my cashier or whoever it is, or my manager, what are the long-term benefits that they should know if they invest this extra time for the first 6 months?
If you have a happy mother, you have a happy employee.
Of course.
Yeah. If you have a healthy infant, that in itself will directly represent a reduced number of days off to take that child to see a physician.
Yeah.
I was in a rural village about 3 weeks ago, and I was speaking to a young lady who was with her infant in her arms, and the topic came up, and one of her responses was, "Doctor, I have never been to a hospital with my child." I said, "What?" He said, "No, I've never been, because I learned that the breastfeeding was sufficient to keep him healthy, and only breast milk. He has never visited, and he has all his vaccines because the mobile goes to that village." The child was healthy. But what I want to say is that it was spontaneous for her to recognize that the health of his child, of that infant,
Was tied to her
was due because of our exclusive breastfeeding.
Yeah.
In regards to the breastfeeding, apart from the exclusive breastfeeding rate of 33, we have a predominant breastfeeding, which is about 50%, which means that during the previous days before the interview was done of the surveys, breast milk was the predominant source of nourishment. Maybe they had other food, not maybe for sure, but breast milk was the predominant. So we also classify that as an important figure, 50%.
When it comes to, but first, I've got to say that, especially when it comes to businesses or these sectors that allows for breastfeeding, or even for those who don't want to, they should realize that a child, it takes a village to raise a child. And empathy along with compassion comes along with it. So they should know these things. But let's get to especially to the nutritional aspect of, for mothers. Some might say, you know what, I'm not producing the amount of milk that I would want to. You know, what in terms of the nutritional aspect of this, Robyn, should they do?
Well, lactating mothers require a little bit more calories to in their meals. So, but the types of foods also play a very big role. So, we normally encourage mothers to have dairy-based foods. Milk, Milo, things like that, and also having a healthy diet. But it's not just, they would be expected to have about 300 to 400 more calories for the day to support breastfeeding. It's not that much, it's just having a little extra snack or a little extra more on your plate, but it's to support the needs for breastfeeding as well. And of course, the prenatals that is given, that continues during the lactation phase as well to provide the additional nutrients that may or may not be provided by the diet. So, but the breastfeeding on a whole, also children that are breastfed, I mean, it has been linked. Studies are showing now that children who are breastfed, of course, they do well in school, they're more attentive, their development is improved, their IQs. Also, it's been linked to NCDs as well. Children who have been breastfed has a less chance of developing NCDs linked to reduced asthma. So there's a lot of health benefits associated with it. And as Dr. mentioned, we want to emphasize that it shouldn't be the mother's right. It's actually a right for the child to get the best nourishment and the best nutrition. And within our first 1,000 days of life, which we promote the maximum nutrition, it is the best food that can be provided, far oversees any formula or anything. So
Yeah,
that's
you
something
can't
that
replace breast milk.
the
It's-
immunity, so
yeah.
the baby's stomach develops during this time,
Yeah.
the immunity, so it's very beneficial. And the whole idea is we can't take it for granted that employers know all of this. So when we have our workplace breastfeeding, that's what we want to do, to encourage employers to understand the benefits and to support, because even if it might be allowing that mother to come in half an hour later, or at least having a longer lunch break, you know, the benefits far oversee the small challenge that they might look at it as.
Yeah.
Some-
Go ahead.
Something very important in regards to the workplace. It's not that it is expected that the management of the workplace would create and build a new space or an extra addition. No, it's not that. It's simply any existing space, whether it's the office of the person or the office of somebody else, or the conference room, or any space.
Not the bathroom, though.
No, not the
Because
bathroom.
we don't eat in the bathroom.
No,
so
no.
the child's food can't go in the bathroom.
Yeah, I'm smiling because somebody mentioned that in that forum that they were offered that space, and they thought they were kidding, but anyway. It could be any space that is available. If there's a will, there's a way.
Yeah.
And the important thing is to let that be that peer support, that support from the other staff, saying, okay, you know what, you decided to, I normally use my office between lunchtime, but you will do breastfeeding, come use this, and I will go somewhere else. Yeah. Tomorrow it could be another office. Yeah. The thing is that the idea is to have that support from the other co-workers, to find that space for that young lady to feel comfortable in either breastfeeding or extracting milk.
Can I, and I'm sure John is burning to ask it, but I'll jump in first. Where are the fathers in the conversation? Where are they included in being advocates as well for the mother of their children in ensuring that their child gets exclusively breastfed?
That's an excellent point you brought up, and it's something that we have been working on. Actually, the fathers, they normally come to sessions at the clinic level, where during, I guess you would say, prenatal care, and that's where most of our education would take place. I could remember Dr. Bear mentioning this to me. The support, just having the support at the different levels in terms of the family, the father, the other children, and that ties in as well with some of our photo competitions that we've had when we look at how the family is supporting breastfeeding. Have sometimes the entire family is there supporting the mother. So these sessions and these talks, yes, those are some of our clips. These sessions normally would take place at the clinic level, and also when we do workplace initiatives to educate on breastfeeding, we would support that, we want to see men at the table as well. So when they're at the clinic level, we encourage men to come and learn more about it and see how they can support, because as you mentioned, it is it's everybody's business and it's a family affair, that kind of thing. So they are there, they're not as much as we would want, but it's all about promoting it and encouraging them to be more present and to be more in the discussion that takes place in terms of the education and the training that would happen with mothers.
And I'll jump out on a limb here, because sitting next to her every day, it's a learning lesson for me. And I'll go out on the limb and say, you know what, us men, we need to do more in the home. We need to take care of business in terms of being there at 24 and more. Now, what this does, and I can tell you this much because I'm a father of 3, and I've got a 10-month-old in my home right now as we speak. In terms of comfort for a mother and her breastfeeding, what does this do for her and the child? Comfort. And I'm saying this from the standpoint of dad being there, because when dad is there, that's extreme comfort for her and for the family. What does this do for breastfeeding?
I'll answer a few, then I'll throw it out to Dr. Polanco. It seems like a medical issue, but I will highlight that the mental health of the mother I think is one of the important factors to look at with the support of the family. Because sometimes you might look at breastfeeding, it is something that can be stressful, and
course.
And
it's
time
work.
consuming in
It's
the
work.
beginning.
So
Yes.
if a mother is expected to contribute, cook, and do all these things in the home, and the father is not supporting, it adds extra stress. So I'm thinking that definitely having the family support, the children doing their extra chores, maybe the father helping with dinner, helping to get their kids with their homework, taking care of the home. This reduces the stress level for the mother. So naturally, she would be more relaxed, more comfortable. It enhances the home atmosphere in that sense, in terms of making her more comfortable, feeling the love, and actually being able to breastfeed, just having a better mental health. And maybe, Doc, you could add in a few in terms of what you think contributions would be.
No, I think the issue of the mental health perhaps is the most, that's the umbrella issue. Yeah, this is a topic already discussed, and roles have been identified for the men. For example, Robyn made reference to them, taking care of the kitchen, assisting with the laundry, assisting with the cleaning of the house, because breastfeeding, apart from being stressful, well, that includes it's physically tiring also. And it's a family issue. That child, that infant is not just, it's of both parents. And we, as Robyn said, some advances have been seen, but I think there is still a lot to go. There is a paternity leave right now in the country. Is it 7 days?
Oh, it's 1 week.
1 week.
1 week.
Why? How come?
In some countries, it's double that.
Yeah.
Double that. The reason is that there is a need for that support.
Yeah. Is there work being done to address this? Because I know we have some great dads here at Channel 5, and they take all their vacation time when their partners have children, and they want to be there and they want to help. But if it's only 1 week.
Yeah.
It's something that we discussed this at the last forum, remember, when we looked at even extending the time for the mothers. We had a discussion about it, and it's something that we have to continue to bring to the table, at least maybe an extra week.
Yes.
Yeah. And of course, it's encouraging workplaces to allow the father to, take time off for this cause, that kind of thing, or vacation leave. So it's something that we need to continue to push and encourage the awareness that it's necessary for that family support as well for the mother. And also in terms of the rest, the mother actually needs rest as well.
Of course.
Needs sleep. Sometimes, you wake up in the wee hours of the morning to do breastfeeding. The child might be fussy, whatever it may be.
Yeah.
So the support is very important within the family structure.
Yeah, and it touches me, especially knowing this. Even if an additional week to a dad, or a half day, because we've got wonderful fathers out there. And another thing that would touch me is going to the hospital. Something is wrong with the child, or probably in the ICU, or just some medical checkup. Only one parent. For me, it really rocks me, because I want to be there supporting my family. I want to be there, but you're not able to. What can be done about this? I'm not sure if this is the perfect forum for it, or to address the situation, but my goodness, it rocks me. It rocks a lot of dads.
I think
one
it shows
parent at a
that we
time.
need to see parenting as dual responsibility versus one, from breastfeeding to everything else, I want to, because we're quickly running out of time, move into the commemoration of the week itself. What are we going to be doing to ensure that there's continued education, continued awareness, and hopefully a bit more converts in wanting to pursue exclusive breastfeeding?
Yeah, one of the things that will be highlighted in this forum is that the traditional 10 steps of a baby-friendly hospital have been revised by the World Health Organization and UNICEF. And they were actually launched earlier this year. And what was included as step number 1 was the implementation of the International Code of Marketing of Breast Milk Substitutes. Because that code was there, has always been there, but it's parallel to the Baby-Friendly Hospital Initiative, even though activities are done in that direction. But now, they were revised. It took 2 years of experts discussing, and they have been, the guidelines have been issued, and as step number 1, they have placed that. So, what that means is that in the case of Belize, there will be more monitoring to ensure that exclusive breastfeeding is promoted, and at the same time to ensure that the access to artificial milk is not is not that accessible, is not that feasible within health facilities. This in itself, the implementation of this code has a section whereby health personnel have a responsibility. There are certain commitments by health personnel, which is to monitor. As Robyn said, in this case, it only applies for the public facilities right now with government. Well, all the hospitals in Belize City, one health center, one of the two is already certified. The other one should be certified by the end of the year, before the end of the year. The next step would go to the other health centers in the districts, which means that there will be a greater geographical coverage of the monitoring of this code, which means then that everybody will be on the alert. Okay, but if you want to deny formula, then you need to inform the parents as to the benefits of breastfeeding. So of course, the focus is promotion of breastfeeding. That's the focus. Everything is a secondary. But at the same time, there is a need to ensure that that it's not easily accessible just because somebody decides.
So we'll have this this workshop or forum next week, the 6th to the 8th, for more or less our health personnel. And on the third day, we're actually having a session with our suppliers and importers of baby formula. So they haven't been invited to attend to learn about our enforcement that we want to start doing for the marketing of breast milk substitutes. So we'll be having that. Also, we're reaching out to organizations within the city as well, well, countrywide, to do some promotion at the workplace. So we're going to be having our team out to do some education and sensitization within different organizations, or private sector, I should say, within the country to, just start to lobby for that workplace breastfeeding. And of course, at all our facilities, we're going to be promoting exclusive breastfeeding as well.
All right, and let's just go through it one more time. When we say exclusive breastfeeding, we mean no water, no gripe water, no sugar water. What else do we get? No formula. It's just breast milk.
That's all what the infant needs.
6 months.
They can continue, they could continue, but after that, the baby's needs starts to increase, and they start to need other foods, that's a different discussion, but complementary feeding plays a role with that, and that's very important as well.
At 6
that's
months,
where
you introduce other things.
That's where our challenges start with malnutrition, actually. But that's a different discussion in terms of what they're feeding after.
One final question, really out of time. But the last time we spoke about the 14% exclusive breastfeeding, when it was separated to boys and girls, the boys were less exclusively breastfed than the girls. Is that still the same?
In this report, I didn't find that.
Okay, so they're equaling out now.
No, I didn't see that figure.
Okay.
In terms of boys and girls?
The boys and the girls in the mix of 2009.
Okay.
In the mix of 2015, I don't remember seeing that difference.
Okay.
I don't remember seeing that breakdown by boys and girls. So I don't know if it was.
We'll check into that. And
we'll have to look into it and see.
All right. Well, thank you so much for coming in. Is there any way, if somebody sees this and says they want to learn more, can they go to the workshop, or is it you've already maxed out your capacity?
It's catered for health personnel, basically. But in the districts, there will be sessions, for example, the one at the workplaces, and every health center has that topic as one of their themes to promote on a constant basis. Information is available at every health center, brochures or leaflets in regards to the benefits of breastfeeding.
All right. Thank you very much. We're going to go ahead and take a break, and when we come back, we'll be talking to an international yoga instructor who's going to be hosting a women's health and yoga workshop. We'll get the details after the break.